Hi, Dr. Winters. Thank you so much for being here with us and answering some of our questions. What challenges have you faced and what concerns have you addressed with your patients that you're seeing now in your clinic?
Just like every other healthcare provider out there, we're trying to kind of wind our way through this. We've got patients that do need to be seen on occasions, and I'm an orthopedic surgeon. Most of my stuff is elective, but I'll have people who come in with locked knees, massive tears, rotator cuff or something, and we'll have to take care of that. I'm seeing about half the amount of patients that I was before this whole thing happened.
What recommendations do you have for those patients who do have the chronic pain right now?
Well, we're still seeing a lot of them in the office, sometimes an exercise program they can work on at home. And I think it does two things. It helps the physical status and probably helps the mental status too. People are doing is that they're still having that mental contact with the patient and have the physical contact. Probably the best thing about telehealth is I want to see patients as much as I can.
So that you can reach out to those patients who are afraid to come out or are unable to come out at this time.
Bingo, you're right, Christy. Some people are going to be afraid, so at least you talk to them.
What positives do you see coming with the use of telehealth?
Christy, you're an excellent therapist, as good as you're going to find. And you're for two reasons. You're smart, you're physically able to diagnose patients, but you also build a rapport with them mentally. And that's probably the one thing that you can continue to do with the telehealth. Be able to be a voice and a face that they can reach out to. And so that's probably the biggest advantage. So if I want to know honestly, if you have a therapist like Christy, then you're going to do great. People are going to feel more comfortable coming back to see someone like this who was there for them when they needed them during that period of time.
Have you had to cancel the surgeries you've been doing because they've been considered non-essential?
Yeah, honestly, Christy, yes, we have. The sooner you get to those, the better. You can call them urgent, you can call them emergent, and what I like to call it is time sensitive. If you don't take care of it, is the person going to get worse? And sometimes to the point where you can't get them better. If you leave a rotator cuff, a massive tear out there for a long time, you're going to get the atrophy, and even if you fix the tendon, they're not going to have the muscle power behind it.
How important is the orthopedic surgeon and PT and OT relationship?
PT is certainly extremely important, and have her go over some exercise for them. Not necessarily go through learning about their PT before, but go over some exercises, make sure you got range of motion back, because it's a whole lot easier getting the range of motion afterwards if you get it before.
Right. Any other pearls of wisdom or advice that you have for patients right now during this time of
stay positive. This is a short-term thing, and I'll be honest, really it's short-term. Somebody said it best, after every red light is a green light. So, be ready to go and, get yourself in the best shape you can.